You've always wanted to get braces, but you didn't want a mouthful of metal. Well, now you can straighten your teeth and keep it a secret. Dr. Haas, the super dentist, is here to tell us all about Invisalign and Teen Invisalign with a couple of his patients. We've got Anna over here and Morgan. And thank you guys, all of you, for coming because, you know, I have known a couple of friends after the fact that had told me that they'd worn it, and I never had a clue. Yeah, we all have the same experience. Anna just told me a story about this weekend. Yesterday, you had a party.
Yeah, we went to a barbecue, and I told a couple of friends that I was coming on the show next day, and they're like, for what? I'm like, well, my Invisalign, and none of them even knew that I was wearing Invisalign, so that was kind of cool.
And these are your friends?
Yeah, these are my friends that, you know, we spent all weekend, all Memorial Day weekend together, and it was kind of neat that they didn't even know.
Yeah, that's the best part of it, of course.
Invisalign, a lot of people hear about it and may think we know about it. What are the things that we need to know, and how do you know if you're a good candidate?
Okay, well, Invisalign is basically a set of removable clear trays that we use to gently move the teeth in an ideal position. And of course, the advantage of Invisalign is that they're removable, so you can eat whatever you want. You can brush and floss easily, and they'll attest to that. And they're very comfortable.
Okay, Morgan, I just want you to know I couldn't eat apples, I couldn't eat caramel, I couldn't eat anything when I had braces. How cool is that you can eat anything and it's not a mouthful of metal? A very good experience. Wonderful. Well, we have some before and after pictures. And before we get to that, Dr. Haas, you said Invisalign Teen is a little bit different.
That's right. Until just recently, we were not able to do Invisalign for teenagers. But as a premier office and as a teen provider, our office has the ability to treat patients during the growth phase. The main differences between Invisalign and Invisalign Teen is that Invisalign Teen has a cooperation indicator built into it, so as orthodontists we know if the patients are being wearing it or not. It has some additional items too, but that's probably the most important difference between that and regular Invisalign.
We're looking at pictures right now. Talk me through these.
Okay, so this is Morgan, of course. She has a little bit of an overbite and some spacing between her teeth, and she's been in treatment. How long have you been in treatment so far? Just a few months. And already I would think her teeth are about 50–60% straight. This is a wonderful treatment for patients who do qualify. We talked about qualification. There are some limitations to it, but we're a premier office, and what that means is that we have an exceptional level of experience using special techniques, treating complicated cases. And for example, Anna, the other patient, she has an overbite, and that's another case that usually wouldn't qualify for Invisalign, but because we have a lot of experience using Invisalign, we're able to treat her, and you can see that she has a significant overbite, especially on that right side of her mouth. And she's, again, currently about 60% corrected on that side. So we use it pretty much to treat even the most complicated cases like overbites, extractions, even surgical cases.
Okay, guys, this may seem really cheesy, but can I get you to do a big smile? So we saw the before pictures, and let's see almost the after. Yeah. Look at that. This is only 60% done, so it's just going to get better from here on out, Dr. Haas.
That's right. It's only going to get better.
Wonderful. Hey, and Morgan, how does it feel? Is it comfortable? Does it bother you? What does it feel like in your mouth?
It's really comfortable.
It is comfortable.
It doesn't bother me. I don't even notice it's there sometimes.
Okay, sometimes you can just forget that it's even there.
Absolutely.
Anna, same for you?
Yeah, I love the fact that I could take them out when I eat and put them back in. It's really easy.
What sort of routine do you need to do? Is there special brushing involved, cleaning, Dr. Haas?
No, that's the nice thing about this is pretty much you can go on living like you always used to, eat whatever you want, brush and floss exactly the way you used to because you take them out. But those are the only times that you're allowed to take out your Invisalign trays.
Yes.
The rest of the time you really need to wear them. And so we recommend a 22-hour-a-day Invisalign wear, and then the 2 hours, you have 2 hours to eat whatever you want.
Okay, and I know people out there might be wondering, all right, super dentist, you guys are awesome, but what about the price? Is this more than regular braces? What's the trade-off?
Well, in our office, actually, it's not very significantly more than braces because, again, we do a lot of it, so we're able to pass along the savings to our patients. So in our office, it's pretty much very fair and very similar to regular braces.
Okay. Yeah. All right, and before we end, one more cheesy smile from our lovely Morgan and Anna. I said, you guys just look amazing. I'm looking at you right now. I can barely see anything in there, and your teeth just look so beautiful, and you can really tell that it's creating some inner confidence for both of you.
Oh, they're both so beautiful, they make me look good.
They do. Oh, they do. Yeah.
He's the best.
You're the best publicist for this guy ever.
Thank you.
Dr. Haas, thank you so much, and Anna and Morgan, wonderful to have you here today.
Thank you.